It's Medical Monday with me, Deep Raj Radio, and you're tuned into Let's Talk. It's the show that really tells it like it is. And I'm starting Medical Monday off early. Why? Because I am very, very, very concerned about this particular topic and what's going on. Our very, very good friends at Komao Medical Group are with me. A very good afternoon to you, Dr. Aman Sharma.
Hi, good afternoon.
Thank you very much for coming on to Dilsa Radio. There's a couple of things that I need to discuss, but before I do that, I'm going to be dramatic, if you like, and I'll say the one thing on Medical Monday that I like to say with you, our very good friends from Komao.
Yes.
Diabetes.
Yeah.
What is diabetes?
So diabetes is a very big topic. So, in the Asian community, it's obviously very prevalent. So first of all, diabetes, there are two types of diabetes. So there's a type 1 diabetes and a type 2 diabetes. The type 1 diabetes is generally found in, your younger population, and it's less related to diet. It's more something you're born with. It's there's a very strong genetic component to it. Type 2 is the one that's heavily prevalent in the Asian community, and that is more lifestyle related, having a lot of high cholesterol in your blood, eating fatty foods, lots of sugar, oily foods, and this can lead to the type 2 diabetes, which has a lot of complications. It's a very big topic, but essentially type 2 diabetes is your pancreas is releasing a chemical called insulin, and that insulin tells your body to take up all the glucose, the sugar, into the cells. But because there is so much insulin being secreted by your pancreas, your body's not responding to it. And as a result, the cells are not taking up that sugar, and your blood becomes very sugary. So what happens is it starts flowing very slowly, becomes sticky, and that's the reason you get all the complications
Is that why you have to inject the insulin?
Well, actually, so that's with type 2 diabetes, that's at a later stage. So first you would try to treat it medically and with lifestyle factors, because it has been shown that you can get your cells to be more responsive to the insulin. So the difference between type 2 diabetes and type 1 diabetes is that in type 1 diabetes, your own body is attacking your pancreas and it's not able to produce the insulin. That's why these people are also known as insulin dependent. They need the insulin constantly because the body's not able to make it itself. But in type 2 diabetes, your body can make the insulin. It's just that your cells are not responding to it. So through good exercise program, diet program, and medication based, you can start reversing the effects of that diabetes.
So what we're looking to get this straight, diabetes is basically where the pancreas doesn't produce enough insulin to break down the sugars and fats in the body, correct?
That's in type 1 diabetes. So it's not producing enough insulin because your body's attacking the pancreas. So, and insulin basically tells the cells in your body to take up the sugar. So in type 1 diabetes, but in type 2 diabetes, your pancreas is producing the insulin, but your body's not responding to it.
Got you. Okay, so that's why you have to have an injection to make sure.
Exactly.
Right. Now, I think the most important thing here is, the bitter pill here. Is it true the Asian community tend to suffer from diabetes more than other communities?
Yes, very much so.
Why?
So a lot of it is diet-based. So, with the Asian food, for instance, Punjabi myself, so, we have a lot of prantas, and the food is quite oily. It's very tasty food, but it is, got a lot of oil. There's a lot of fat in the food, and generally that can raise your cholesterol, raise your sugars, and it's that kind of diet that puts you at risk of developing diabetes.
Okay, so first of all, let's get this straight. It's the diet that the Asian community have. Let us be honest here, we don't use a lot of ovens, do we? We fry a lot.
Exactly, yeah.
And that frying tends to take the goodness out of the food.
Yes, definitely, right? Yeah.
Now, I don't think whether you're Punjabi or Gujarati or South Indian, there's a problem here. I think it's more the fact that you've got the Asian-based diet, right?
Yeah.
So can you therefore tell me, and my lovely friends and listeners, if we have a diet base that is giving us diabetes, should we not be being educated about this through doctors and even dentists to a certain extent, but doctors and other people? Why are we still doing this? Because if we know we're hurting ourselves, why are we doing it?
I think that's a very good point. So as you know, as doctors, not just doctors but dentists, anyone in the healthcare profession, pharmacists, we should all be out there sending that message, to the Asian community that it's okay to enjoy, our food, reasonably, but not to be eating too many fried prontas every day, not to be having too much fried food every day, because even oily food, because you are putting yourself at risk, especially with the Indian sweets as well, like jalebis. Once in a while, of course, is fine, but doing it regularly is not good.
Now, I'll come on to jalebis and Indian sweets in a minute, because that, I feel, is a separate kind of topic related, but a separate tree in the topic. I want to ask you, people have told me, they say, okay, rice and chawal is good, but did you know it contains 6 spoons of sugar? Now, I didn't know that. Now, there are certain foods where you think you're doing the right thing by eating them, such as paneer, such as chawal, such as saag, and we didn't realise that there is sugar in these things, and that can give us diabetes. If we don't know what is the problem, i.e. what contains what sugar in it, why are we blaming ourselves?
I think that's a good point, because when you go out to eat at a restaurant, there is a lot of sugar, a lot of oil in the food that you wouldn't necessarily make if you were making these dishes at home. And you're eating like a saag or a like a chole at a restaurant, and it tastes very nice, but you don't know there's a lot of sugar in that.
They physically put the sugar in.
Well, when they make the recipe, in some restaurants, I guess so, yeah.
But generally, naturally speaking, doesn't rice have a lot of sugar in it?
So rice would have a high glycemic index. So there's a lot of carbohydrates in it. So with diabetes, you have to understand there's a difference between having lots of high carbohydrates and high fatty foods as well. So if you are making these kind of foods at home, you can control what ratio of carbohydrates you're eating. So generally speaking, if you have a plate of food, it's not, you can't say you shouldn't have any rice at all, but maybe if you have less rice and more choles, more chickpea, then you're having more protein and less carbohydrates. If you control the ratio of your protein, your carbs on your plate, then that's absolutely fine. It's no problem. It's a healthy, balanced diet, basically.
Okay, we're going to come back in a minute after a quick gold rate update. What I'm going to look at now are two things. One, how can we decide what's good for us and not? And I'm assuming coming to you as a doctor and a GP, you can advise, but we'll go into that. I will then look at the sweets and look at how we can perhaps get, I'll be honest with you, sugar-free sweets and stuff like that. And then we're going to look at confidential discussions. How can they come to Komao, talk to you, or even if it's a woman wanting to talk to another woman, how we can do this and keep that confidentiality impact, because I know with a lot of the Asian community, I know in my house, if I sneeze, everybody knows I've sneezed, and everybody will start asking me if I got a cold. Excuse me, I've just sneezed. It's not the end of the world. Yeah. So we need to be able to sort of keep certain things to ourselves, and we're going to look at how we're going to do that with our very good friends from the Komao Medical Group. My name is Deep Raja. This is Dilsa Radio. You're tuned into Medical Monday, and we're talking all things diabetes. Have you ever suffered from diabetes? Do you know anybody who suffered from diabetes? But I think more importantly than that, if you had it all over again, and the knowledge you know now as to the knowledge you knew when your relative or whoever you knew had diabetes, could it have made a difference? My name is Deep Raja. This is Dilsa Radio. You're tuned into Let's Talk, the show that really makes a difference. I'll be with you and our lovely friends from the Komao Medical Group after this. Good afternoon. And a very good afternoon to you. It's Medical Monday. I started this one early because I am very, very concerned. With me are my very good friends from the Komao Medical Group, Dr. Aman Sharma, and we're talking here about diabetes. Dr. Sharma, let's get back to this situation in hand. Mm-hmm. Earlier on we said that things like rice and other things, products we don't even know have sugar in them, or the carbohydrate turns into sugar, and then the excess sugar that your body can't handle then starts to give you the problem.
Exactly, yeah.
How important, therefore, before having diabetes, if you're going to get it, is exercise?
Exercise is extremely important. So staying active is one of the best ways of preventing yourself from getting diabetes. Not living a sedentary lifestyle where you come home late from work. It's very easy to get into that bad habit. You just sit on the settee, just watch TV, eat your food, and then go to sleep. That's not a good lifestyle to have, because you want to try and stay active throughout the day. They recommend at least 30 minutes exercise at least 5 times a week. And if you're obese, then it's actually 1 hour of exercise 5 times a week. So having some form of exercise, at least on a daily routine, is very important.
Will that stop diabetes?
Well, it's difficult to say whether it can stop, because some people are more predisposed to it than others, and there's a very strong genetic component, but it can heavily reduce the chances of developing it. Yeah.
What if a person has diabetes already and perhaps takes up exercise? Can that reverse the process?
Yes, evidence has shown that it can actually reverse the process if you combine that with a low-calorie diet as well. So, for instance, from my experience seeing some patients, I saw a patient who came in and he had we call this an HbA1c blood test. That's basically an average of your blood sugars over the last 3 months. So his HbA1c was very high, it was 13. Then after he was told, about the diagnosis, I explained what diabetes was to him, how much exercise he should be doing, his diet. So he really changed things around. So he went from an HbA1c of 13 all the way down to an 8, which is incredible. It's an incredible improvement, in his blood test. So if you stick to a low-calorie diet and you start doing lots of exercise and you do it early on from the time you're diagnosed with diabetes, you can certainly start changing some of the effects of the diabetes and maybe not even need medication.
Right, let's get to that. Very, very good point there. You could reverse it. I know people have reversed it.
Yeah, they have, yeah.
But I want to get back to this point that we hate talking about, but we have to. Confidentiality. Now, there are times where you don't want all of your family to know what you're doing because things can get a little bit out of hand. Sometimes some families can be a bit too interfering with each other. Let us be frank about this. So when they come to you at the Komao Medical Group, first of all, tell me where you are, but second of all, tell me what is the key here.
Yes, so we're based in Shepherd's Bush, but you're absolutely right. So confidentiality is so important. It's so important because basically everything that you discuss with us, that information, no one else has the right to know that information except the doctor and the patient. That knowledge is only between us two, and it's a very important relationship of trust that you need to build, and it can't be broken. So anybody who comes, we do, not just us, but any doctor throughout the country has to respect confidentiality. It's the foundation of good medical practice.
So the point here is that they can come to you, the Komao Medical Group, and they can ask you about maybe whether they've got diabetes. Can you do a check? What can you do? How does it work?
So we can do a diabetes screening check. Check for, well, first of all, do they have it? Are they at risk of diabetes? If so, we can give lifestyle advice. We can manage it medically. A lot of things we can do for sure.
Okay, so let's turn it a minute now. Sometimes certain people, especially ladies, women, they don't want to talk to a man because they're a little bit embarrassed about the whole situation. Can you accommodate for that? Can I get perhaps a lady to talk to another lady? Is that how it works?
Of course, yeah. So
right. Why would they do that? Is there certain diseases in terms of diabetes that women suffer from more or less compared to men?
Yeah, so diabetes can affect men and women in different ways. So one example of an issue that, for instance, a lady would not maybe want to talk to with a male doctor is thrush. So thrush is more common in diabetes than in patients who don't have diabetes, and this might be something a patient would be more comfortable talking with a female doctor.
Very good point there, and also again in confidence.
Exactly, and in confidence. Yeah.
So she when she goes to the doctor, she knows that you're not now going to ring up her mum or dad or her uncle or her aunt and say,
no.
Look, this lady's coming, you better sort her out.
No, confidentiality is the foundation of good medical practice. I can't imagine any doctor breaking confidentiality. It's drilled into you, during your training. So absolutely.
Moving on again, because you mentioned 2 or 3 very, very important things. 1, what diabetes is. 2, on what diets can actually affect it. And 3, the confidence part. And 4, of course, the women and men separation. What we haven't looked at is, I know that you also specialise in Botox and hair removal. If somebody wanted hair removal and they are diabetic, would that make a difference?
So you mean hair transplant?
I'm very sorry, hair transplant. I've left my hair. Hair transplant.
Hair transplant, yeah.
If you are diabetic, would that make a difference?
It does make a difference, yeah. It makes a big difference. So I would only go ahead and do a hair transplant for a patient who has very good control of their diabetes. So I would want to see, for instance, that blood test I mentioned, the HbA1c, that is under control. Because if you do this procedure on a patient who has very high sugars, their diabetes is poorly controlled, it's very likely they're going to have a lot of complications after the procedure. For instance, a lot of bleeding during the procedure itself, infection afterwards, and also delayed healing. So I would do a screening check before I would go ahead with the diabetic patients, just to make sure that their sugars are under control. If they're not under control, then we would need to work to get them under control.
Okay. Oh, you would work to get them under control?
Yeah. I mean,
how would you do that?
Well, for instance, lifestyle advice, medication. If there's no way that they can get it under control, then they simply aren't feasible for the operation.
Okay. We're moving back to diabetes, because I know that we do this. Where are you based again, and what's your telephone number? Have you got that?
Yes, so we're based in Shepherd's Bush.
But it's on the Uxbridge Road, isn't it?
Yeah, it's 41 Uxbridge Road, that's right, yes.
Do you have your number on you at the moment?
Yes, so it is 0208 749 4640.
So that is the Komao Medical Group. Now, before I go further, I'm just reminding them, lovely Francis, it's not just about Botox. It's not just about hair transplant. If you've got a personal medical problem, or if something's niggling you in your mind and you need to get it looked at, or perhaps a relative has come from another country and maybe needing to get some medical treatment or a chat, you can see them as GPs in confidence, quietly, and without any need to perhaps make lots and lots of waiting time and appointments. Is that true?
That's true. So we are a private GP, and the big plus point of that is you can book an appointment at your own convenience, and the waiting times are 0 to, that's the main benefit, really.
Right, moving on from that, which I think is very important here, because it's Medical Monday, I always like to see this. When you look at children, for example, there are some children who have diabetes or get pronounced with diabetes, unusual thirst, shaking a lot, waking up and shaking, thirsty, something's not right.
Yeah.
How or what would you recommend if a parent is perhaps seeing their child, especially Asian parents, because we do like to feed our kids and everything like that. They're drinking a lot, they're shaking a little bit, you're not 100% sure this is right, you don't want to wait too long, can they come to you? What do they do?
So they can. So this goes back to when I was explaining about the 2 different types of diabetes. So with regards to children and even teenagers, it's not that it never happens, but it's very rare to get the type 2 diabetes with children and teenagers. It usually tends to be the type 1 diabetes, where their own body is attacking their pancreas. So it's a different kind of diabetes, and this needs more specialist care. Like, for instance, they would need regular insulin, and obviously lifestyle is still important, but it's a completely different kettle of fish. They can come to us, but we would have to liaise with a specialist how to best control their diabetes.
But the initial understanding, if somebody said to me, I think my kid might have diabetes, they can come to you and you can initially say, I think your son or daughter, despite them only being, say, 8 years old, has got a possible diabetes problem. You need to go to a...
Exactly, yeah. We can help to confirm the diagnosis. For instance, we could do a simple thing like a urine dipstick. Normally in our urine we shouldn't get glucose in it, but if there was a child or teenager who has got diabetes that has not been formally diagnosed, a simple urine dipstick can help for us to see if they have got diabetes. So these kind of things, and also some of the symptoms that you mentioned, like they would be peeing a lot, they'd be very thirsty, losing weight, sweating, all these kind of symptoms.
It doesn't make a difference. Okay, interesting point here. If you want to chat to us today, you can on 0203 515 1035. Are you suffering from diabetes? Do you have a relative who suffers from diabetes. Are you a carer for someone who has diabetes and the problem is that they don't listen to you? I'll give you an example, and Dr. Sharma, again, this is what I'm trying to work out here. Some of the Asian community, especially the elder generation, the granddads and the grandmoms, they have felt like, I've never seen doctors before. I'm not going to see a doctor again. You just keep quiet. Let me eat my laddu. Let me eat my jalebi. But actually, the more you say to them, don't eat it, the more angry they get. Is there a way around this that you can get round it? Sugar-free sweets, for example.
Yeah, sugar-free sweets. It's interesting you mentioned that, actually, because in some people it works, the opposite way. If the more you tell them not to do it, then the more, they will do it. So it is an interesting approach in how you would tackle that lifestyle decision for those patients. One way of doing it is just to try and encourage them to eat more fruit and vegetables, like you did mention, sugar-free sweets. That's another alternative. But also just for these kind of people to come in and see us, just so they can understand, what are the complications of diabetes. If they keep on eating like this, there are very serious complications that can develop, and making sure that they understand these serious complications.
Can you get sugar-free Indian sweets?
To be honest, I'm not sure, actually. I don't know.
Interesting point, though, isn't it?
Yeah,
say
it
sugar-free
is.
jalebis or sugar-free gulab jamuns.
Yeah.
I'm not saying burst them up with saccharin, because that can also have a bad effect on you. But the idea of taking out that sugar, would it not help?
Yeah, definitely. Of course it would, yeah.
Okay. 0203 515 1035. Have you got a diabetes problem? Do you know anyone who suffers from diabetes? Have you ever had problems with trying to sort out people with diabetes? My name is Deep Raja. This is Dilsa Radio, and I was just about to go into a break, and all my lines have just filled up. It's Medical Monday with me, Deep Raja, and I'm going to go straight to the lines. I'm sorry to keep you, caller. Good afternoon.
Good afternoon, sir. Can you hear me?
I can hear you very well. What's your name, please?
Do I have to give my name, my friend?
No, you can call yourself Mr. Dilse. What can I do for you?
Right. Very good things been going on now. The gentleman is saying that you have to be active and do this and do that. But if you don't eat, how can you be active? A car without petrol can't run. A person with nothing in his body can't walk. So you have to eat something, and they say, have a little bit of glucose or a little sweet to be active, give your system going on. So all these things does stop you doing. Now, 2 days away, a friend of mine, very good friend of mine, was diagnosed of vitamin D and on a borderline diabetic. So the doctor gave him a tablet to have. A healthy person, a DIY person, now he's been stopped to have sweets. He will worry, I don't want to have sweets because they say don't eat sweets. Don't eat that, don't eat that. I mean, the person is losing weight and his life becomes so miserable. He just went for a checkup, comes back, not to eat that, not to eat this. When you go to the shops, you see a very big shelf there, health food, 1 for £1. Next to it, you have pastries, you have this, you have that sweet, you have that sweet, 2 for £1. What will you do? You will go for 2 for £1. So I think the organization or the organizers of this diabetic, they should bring this thing, a strong topic, to the shopkeepers or the big stores that, look, these things have to be avoided. Even drinks. Not a drink you will find has no sugar in it. They say sugar-free, fine, but there is little. But most of the time, sometimes you can't find sugar-free drink. You want another drink. So if there is another drink, maybe another different kind of a drink you want to have, and you look into the label, there are 4 signs up there, red, green, and blue, something like this. And red is very strong sugar level. You can't have that. Not a single drink you will see has no sugar level. Everyone has that red level. So don't you think something should be done about that?
Right.
What can you eat? What should you eat, by the way?
Caller, you've made very, very, very good points. I'm very, very trusted, but I need to get the doctor in to get that point. What do you think? Doctor, he's saying at the end of the day, it's so tempting, both financially and dietary, to buy sweets because there's 2 for 1 this. And to be honest with you, he's got a point. Junk food is always cheaper than good food. What are you meant to do?
Yeah, so you definitely make a very good point, actually. That when you do go to Tesco's or whatever supermarket you shop from, there is a temptation buying junk food because it can be a lot cheaper. And I think the government does need to do something about that. And for instance, like they introduced a sugar tax on sugary drinks, they need to try and do something similar with the junk food to make healthy food more appealing, like fruit and vegetables. So that's definitely something that needs to be more proactively engaged with government policy, definitely.
Does that make sense there, caller?
Yeah, but just one thing more before I go, sir.
Yes.
Now, when you are on tablets and you're trying to control yourself and you're seeing your level is coming down, can they stop the tablets for you? Or they say, or the doctor will say, no, you must keep on taking the tablets.
What do you think? Can you do that? Is he right?
So I think, like we were discussing before, a lot of it depends, how quickly you've been diagnosed with diabetes. So if it's early on and you do implement the lifestyle changes, you start doing more exercise, you eat more healthy, more fruit and vegetable, then there have been a lot of cases where the diabetes has been reversed, or you've got very good control, so you can come off medication. Even if you've had diabetes for a few years and you do make radical lifestyle changes, then I have seen patients who can come off the medication, but you would need to have a good discussion with your own doctor before you'd make this decision on your own.
That's very kind of you. One more thing, sir, before the doctor goes, can he please say a few of the things you should eat? I know diet you are saying, but give a person like, all right, this sugar, rice, something else, meat, fish, what is more thing you should eat to avoid these things?
So it depends. So if we divide to vegetarians and non-vegetarians, so let's say, for instance, for vegetarians, then quinoa is quite good for you, chickpeas is good for you, kale is quite good for you as well. A lot of these kind of things. And if you're for non-vegetarian, then like grilled fish, grilled chicken rather than fried chicken, some fish with very oily fish, because certain oily foods are actually very good for you and known to reduce cholesterol. So these are the kind of suggestions your doctor might advise to you.
Well, very kind of you, but I would really like the diabetic people, like the doctors or the organizers, to look into these big stores, walk about, go and look around, that why they are keeping the sweets so much sweet, and when they, at the end of the day, a little poor child is found out, oh, he's diabetic, could not help it because there's so many sweets. There's a lot of sweets on outside there, and new people should look into that, sir.
Do you agree with that?
Yeah, I
Thank
do.
you.
I do.
Thank
agree.
you so much, caller. You've made a very good
Very
point.
kind of you
Can I
listening to
just
me,
say,
sir.
though, please do remember,
go on.
though, caller, that just because the doctor has said certain fruits can be good, you cannot substitute them for, health and exercise. You can't just say, well, if I eat kale, I'll be okay. It doesn't work like that, correct?
Yeah, you
That's
need to
what
do
I
some
meant.
exercise
If
as
you
well.
can precisely say that, right, these are the things which affects affectable items, like they say, oh, Karelas are good for you, the soup, or you eat that, they are good for you, or good for your eyes, or these are good for you. If they are really surveying also when people come for diabetic checks or things like that, what is their intake every day like?
Okay, very, very good point there. Thank you. You made a very good point. Take care.
Thank you.
All the
Bye.
best. Bye. Going to the next caller. Good afternoon. Who's calling me on Dilsa Radio? Hello.
Hello,
Hello. What's your name, please?
Dina.
Bina, you're through to the doctor. What would you like to say?
There's a couple of questions I've got. One is that what sort of sugar level one should have if you're not suffering from diabetes, and what kind of test one should get to make sure that you are not going to get diabetes.
Very, very good questions, Bina. Thank you for calling. Right. What? Let's start with the first one. What should you do to check that you are not getting diabetes? What kind of test is it? What she asks.
Hello, Bina. So basically, when you go to your doctor and you want to be tested for diabetes, so there are two things your doctor can do, and it's a blood test. So the first one is they would ask you to get a blood test early in the morning. We call it a fasting blood test. So this will check your blood sugars. So if your blood sugar is over 7 and you haven't eaten anything in the last 24 hours since that blood test is taken, then you would have a diagnosis of diabetes. So you shouldn't have a fasting blood sugar more than 7. Then the other thing is that nowadays most doctors are doing is they will do another blood test where you don't need to fast. This blood test, like I was talking earlier with Deep, is a blood test called HbA1c, and it looks at your average blood sugars over the last 3 months. And if this blood sugar is above the limit for diabetes, then again you would be diagnosed with diabetes.
Okay, she's actually gone off the phone, but I understand why she's actually done that. She wanted to hear people, and that's a very good question. Bina, if you're listening, thank you. That's a very good point there. And is there another test that one can take to check beforehand that somebody, if they carry on living like the way they are going to get diabetes?
So those are the main two tests, so the HbA1c and the fasting blood glucose test. There is another one that you can take, and this is more common for instance, when women are pregnant. So, for instance, pregnant women, you wouldn't advise them to be fasting for a long period of time because it's not healthy for them. So, in this case, what you would do is you would give them we call it oral glucose tolerance test. So you give them a sugary drink, and then you take their blood test 2 hours after they've had that drink.
Finally, I mean, this is a very important point for us all, actually. Can we get these tests done at your Komao surgery?
Yes, you can.
So you can do all the tests quickly, succinctly, and in confidence?
Yep. Yeah.
Okay, interesting point there. 0203 515 1035. Have you had diabetes? Have you ever suffered from diabetes? Do you know anybody who has suffered from diabetes? I think also what I'm really concerned about, my lovely friends and listeners, and I'm serious here, is that the elderly generation who say, and they eat ice cream, or they say, and they'll have a laddu. And what they're doing is, as the body gets lesser and lesser, lesser and lesser healthy, they're getting more and more ill. I'm going to take one more phone call on this. Before we go to the break. Good afternoon. Who's calling me on Dilsa Radio? Hello.
Yeah, hi.
Hi. What's your name, please?
My name is Rahul.
Haji Rahul ji, kya kehna chahte ho? What would you like to say?
Boss, actually, the reading which he has mentioned, 7 fasting, I think I don't agree because the doctors say it should be 5.6 or 5.7.
Doctor, would you like to explain to him what you mean?
Sure. So, fasting blood glucose over 7, so you would be diagnosed with diabetes. However, there are other terms called impaired fasting glucose. So, I don't know if this is what your doctor meant by when he told you. So, if you've got a glucose level between 6 and 7, that is fasting, then that's called an impaired fasting glucose blood test, and it means you are at risk of developing diabetes. You just don't have it. You don't have the formal diagnosis as yet, but there is an increased risk.
So you are saying that if it's around 7, then we have a risk of having diabetes.
So if your fasting blood glucose test is between 6 and 7, then this is an impaired fasting glucose test, and you are at increased risk of developing it. If you're fasting...
So then you should not mention the 7 is normal.
No, so if it's over 7, then you have a diagnosis of diabetes.
No, even 7 is a borderline.
No, over 7 is a diagnosis of diabetes.
No, over 6, actually 6.5 or 6 to 7 is also a borderline. 7 is not a normal, that means you have a diabetes. Yes. Because I will tell you now, I am diabetic from last 25 years. I am on insulin, so I was not agree with you when you said that it should be 7.
No, I didn't say it should be 7. I said if your fasting glucose is over 7.
7 you mentioned. Maybe it's below 7 or 7. It should be...
Caller, let him finish for a second. Hold on. What did you say, Doctor?
So if your fasting glucose is over 7, then you have diabetes. If it's between 6 and 7, then it's an impaired fasting glucose, and you're at increased risk of developing diabetes.
Yes, now you're mentioning 6 number. You didn't mention before.
Well, you've done it now, so that is an interesting point there. Thank you very much indeed. You've made a very good point. Next caller. Hello. Who's calling me on Dilsa Radio?
Hello.
What's your name, please?
Hello, Raj.
Hello. Can you turn your radio down, please?
Just a minute, yeah.
Because,
Can you ask the doctor, in the Rabina, they said it's no sugar. But when you drink, it's full of sugar. All the other things, they say no sugar. Can you check it with him, please? Why they write it that no sugar?
What's your question exactly?
My question is, when you drink Rabina, when you drink Coke, they said it's no sugar, Diet Coke. But there is sugar there. So you should check with the employees why they put it that there.
Okay.
That's all my question.
You heard that, didn't you, Doctor?
Yeah.
Is it true, or is it more saccharine that she's thinking on?
So, for instance, with the diet drinks, it's not so much sugar. It's
It is the sugar, dear. You check it. When you drink a diet sugar, diet Coke, there's a full with the sugar in there.
Is it? Or is it not?
It's not sugar, but it's like an artificial preservatives that they put in
No.
that makes it taste.
It is sugar, dear. Can you check it? And check with the employees, please.
Okay, will do. But
Okay, many thanks.
Thank
Bye.
you. Bye. Okay, we're going to go into a quick commercial break. My name is Deep Raja. This is Dilsa Radio. You're tuned into Let's Talk, and it's Medical Monday with me. Good afternoon. It's Medical Monday with me, Deep Raja. Very good afternoon to you. It's very, very close to the news. I'd like to say thank you to our resident lovely doctor from Komao Medical Group, Dr. Aman Sharma. Amanji, if people want to see you regarding diabetes or anything, what can they do? What's your number and where can they get you?
So our number is 0208 749 4640, and we are at 41 Uxbridge Road in Shepherd's Bush.
Please go and see him and and mention the words Dilsa. And I'm telling you, somewhere down the line, a little bit of advice from him and his wife, who's also a doctor, can actually, in confidence, help you. Look, it's been a great show. Thank you for that. And after the news, we'll be talking other things and other topics for you. Plus, I've got the music out. My name is Deep Raja. This is Dilsa Radio. I'll talk to you after the news.